Hello, I'm Dr. Sundari Mace, Sonoma County's health officer. I'm here to share the latest updates on coronavirus in Sonoma County with you. As of today, April 27th, there are 220 confirmed cases, up to in the last 24 hours. 115 of them are active and 103 have recovered. We still have the same 2 deaths that we had initially reported, and now we have performed 5,329 tests. So I greatly appreciate the questions and comments coming from Sonoma County residents over the last few weeks, and we'll be addressing some of them in today's briefing. I'd like to share with you a bit of how this weekend's drive-through went. It was actually quite seamless, and we were able to test 460 healthcare workers, both symptomatic and asymptomatic, in the drive-through testing this weekend. So we will continue this drive-through testing that's happening at the Shenate parking lot. That is the parking lot of the Sonoma County Public Health Lab. So far, it's been very seamless, and we've been having no issues at all with the process. So testing the group of healthcare workers is really important because they are our frontline providers, and they're the ones that are most likely to be exposed to COVID-19. We will have the results in the next few days, and we'll be able to present the results to everybody. I'm really hoping that from this group, we'll get a good idea of how many, if any, cases of COVID we have in asymptomatic persons. Again, I had said before that the data shows that up to 1/3 of people who have COVID could have no symptoms or minimal symptoms. But this will test our hypothesis, and I think we'll have a lot of information from it. So after we have finished testing healthcare workers, we will be moving to testing our first responders. That's our law enforcement officers, our firefighters, and our other EMS providers. After that, we are going to test people over 65 and those with underlying medical conditions who are symptomatic, followed then, of course, by the general public who are symptomatic. We will announce which groups we're going to test as we move forward. So the new ability to test that we have is getting us a lot closer to meeting one of the governor's 6 key indicators for modifying the stay-at-home, shelter-in-place health order. So if you're a healthcare worker and you meet criteria for testing, you should call 707-565-4667 to schedule an appointment. You'll be asked a series of few questions and given an appointment, hopefully for some time this week. Let me go ahead and define a healthcare worker. Healthcare worker is any individual employed at a healthcare facility whose job duties put them in contact with patients regularly. This includes medical staff, such as nurses, nursing assistants, and doctors, respiratory therapists, phlebotomists, lab workers and technicians, in-facility pharmacy staff, social workers and counselors that work in healthcare facilities, front desk intake staff, dietitians, housekeeping and janitorial staff, and security staff that are working in healthcare facilities. Again, if you meet these criteria, please call 707-565-4667 to schedule an appointment. So thanks for joining today. Take care of yourselves, stay healthy, and we'll talk again tomorrow.